Today we're going to talk about understanding different transition zones of the lower face. A lot of times when we talk about rejuvenation, we're so focused on lifting something that's fallen down or whatever it may be. And if you watch my video on rethinking gravity, you'll see that gravity is actually either a very minor or inconsequential component to the face. So I want to talk a little bit about what the lower face has to do with all this. Now, it's very hard for you to really understand this unless you look at my before and afters and get a more concrete idea. But with the tools that I'm going to provide for you through this educational video, I think you're going to get the vocabulary to begin to understand how to look at my photos more effectively. Let's start with an area called the buccal area, B-U-C-C-A-L, buccal zone or buccal area. It's the area that resides between the cheek proper and the lower face. So it's this area. When you suck in this area and you get hollowness in this area, it's an area that's so very, very important. I lectured on this past year in 2008 in St. Louis about really understanding the buccal area, and I actually am featuring that in my new book on the aging face called The New Paradigm Aging Face by Elsevier. And really, why do I focus on this buccal area? Here's the reason why. Remember I talked about uniformity and joining parts of the face. We're so focused on what's called the mid-face lift, we're so focused on the jawline lift or whatever rejuvenation of these two parts, we don't think of the transition between the two parts. So right in this area here, the buccal area, we need to think about how to join these two areas. So that way, let's say I work with the cheek and I augment the cheek upward and the cheek is full. Well, is that necessarily pleasant? No, because if this is just full and this area is hollow, there's going to be too much of an abrupt transition where the cheek just looks cheeky. My goal is to actually take that cheek and blend it down to the lower face and join it. So uniformity means airbrushing the face almost by joining the upper mid-face, to the lower face. Now, I've actually refined this thinking of looking at this buccal area and dividing it into three areas. The three areas are going to be the central buccal area, and this is really more focused on someone that's really gaunt. Now, if you're heavier, I'm actually probably going to leave your buccal area alone, and I'm actually going to offset it by building the anterior cheek so that that portion makes the buccal area look smaller. But if you're gaunt and this area is really hollow, I'm going to be working to blend this area in. Let me explain to you how I mentally conceive the buccal area and subdivide the area into three components. Now, if you don't understand all the details, it's okay, because ultimately I understand it and I know how to build it. But I want to give you some tools of education as you evaluate a face, whether it be your own or someone else's, or even my before and afters. The central buccal area is a classic area for hollowness and is an area that I work on to fill. But is that enough? No. Oftentimes, the older we get, the teeth begin to sink in, so we can lose a little bit of the bony area here. But instead of putting in like teeth or breaking your bones and fixing that, a little bit of soft tissue coverage right in this area, I call it the medial buccal hollow, right in this area will give me that youthful shape to the area where the teeth used to be when you were younger. Now, even younger people may just be born with a deficient bone area, so I fill this area. So we talked about the central buccal area here, the medial buccal hollow, which can be more of a representation of bone loss. And then sometimes when you're really gaunt, or if you've had an aggressive facelift, to be honest with you, the classical facelift pulling back, the lateral area, the area out here, the backfill zone, right below the cheekbone can look really, really depressed. And so by reanalyzing the buccal area, you can really get a better sense of understanding of how to subdivide that area. What's really interesting, I did a blog about 2 weeks ago on Abraham Lincoln. He has a centennial coming out, and there was a plaster cast of his head in 1860 when he was running for president, in 1865 in February, about 2 years before he was assassinated. And what's so amazing with these plaster casts was that there was extremely little to do with wrinkles and gravity when you looked at the face, but when you looked at this shape, this geometry of the plaster cast, there was no question that that 5-year time gap showed a significant amount of aging, most likely due to the Civil War and various other external factors that Lincoln had. The number one area was the buccal hollowing that led to a much older look. So the buccal zone in a lot of people is an important area to work with to create balance. Now, I want to talk about the jawline, an area that's so misunderstood. Oftentimes we think the only thing that we can do to make that jawline look better is a lift. What's really interesting in the video I shot about rethinking gravity, which is really quite brilliant, is a colleague of mine looked at the jawline and found that in youth, this is going to blow your mind if you haven't heard this, the jawline is lower in youth and ascends or goes upward with age. You say, well, how is that possible? I got a jowl, it's hanging, doc, come on, I need a facelift. Not necessarily. The reason behind this is actually what happens in the lower face is that everything recedes up to the bone and exposes your jowl. So you don't necessarily need a facelift straight off the bat, even if it's a jawline issue. So what happens is I want you to start rethinking the chin area, and I want you to start looking at my before and afters in the chin area. And some photographs are going to be more obvious than the others, but I have a new idea that I've come up with that's coming out of my new book next year called the upside down U. And what is that? Essentially what it is, it's this zone right here that hollows out. Our chin actually sticks out like a bone island, and we start hollowing around this upper portion of our chin. So the area in front of the jowl right here and the upper chin, it's the upper chin. So where your brain sees positive problems, and the positive problem is I've got a fold and I've got a jowl, rethink it. It actually has well, sometimes the line needs to be fixed and sometimes the jowl needs to be fixed, but it's oftentimes this area, in this area, that's the problem. If you begin to start seeing an upside down U of bone exposure, you truly begin to understand what ages the chin in a profound way that I think is exceptional, because even a lot of the plastic surgeons out there are looking at the wrong thing. They're looking at a fold and looking at a jowl, and oftentimes that's not the case. So the upside down U is so very, very vital. Another thing I want to talk about, and maybe a little bit esoteric and difficult to understand, if there's a large jowl, yes, perhaps a facelift would be the answer. But interestingly enough, not always the case, and here's when I make that distinction. If the neck is hanging, we're going to look at a neck lift. But in the outer portion, this area, a lot of people say, I don't want to look fat out here. Well, if you are fat out here or heavy out here, I'm not going to touch it. But if you're gone out here, and usually what happens is after a traditional facelift, they suck out the outer mandible or outer jawline. This area looks gone and sucked in. What I do is I actually sculpt the mandible out. And if I'm looking at the jowl, I'm filling in front and behind the jowl to bring the jawline down around the jowl so the jowl looks less prominent and looks blended in. So often, and here's an example. I had a nice lady in early December who was saying, Dr. Lamb, I need a facelift. I need a facelift because this needs to be pulled back. What's really interesting is she actually had a jawline advancement where that jawline advancement lost her mandible out here. This was gone, and her cheekbones were way out here. So if I had done a facelift for her, a conventional facelift, or even the facelift I used to pull upwards, I would have lost more volume into this area, and her face would have looked less attractive and not as balanced. So in this situation, I rebuilt the mandible to create more harmony and more balance, and she absolutely looks gorgeous, and she was in love with the result, even at 2 weeks when there was swelling, because she began to see the beauty I created. So I want to just briefly summarize what we talked about. We've really focused on the lower face in understanding how to use fat transfer to soften transition zones, one in the buccal area, and subdividing that into a backfill area way back here, the central buccal area, and then the area where we lose bony teeth in the central area. We've talked about the upside down U and understanding the anterior chin bone exposure, as well as the pre-jowl, the area right in front of the jowl that forms this upside down U of bone. If you start seeing that upside down U, you'll begin to understand aging, I think, in a much more profound way. And then in certain circumstance, probably I do this once or twice a month, I start to rebuild the outer jawline in someone that's either had an aggressive facelift or just from aging has lost this area, or like the example I used before, from aggressive jawline advancement, the outer mandible has been lost. So rebuilding the area in select patients can be very, very beneficial to create more youth and balance.